Hey, how you guys doing? I'm USMC Doc 14 from jkowners.com, Pirate 4x4, and this is a continuation on our videos of basic wilderness field medical care. I am a trained medical professional. All the information I'm doing is for demonstrational purposes only. If you'd like to get better practice, please get involved with an actual hands-on activity and learn your medical procedures better. First part with the series we did was a tourniquet. Now, a tourniquet is for uncontrollable arterial bleeding. Okay, keyword being uncontrollable. Now, arterial bleeding, especially from a major blood vessel such as your femoral artery, can kill your ass very quickly. Okay, we're not going to get into numbers, just ridiculously quick. And also, arterial bleeding is unlike anything you've ever seen. It's insane amount of blood gushing out, spurting out, spraying you, spraying the walls. Okay, anyway. Tourniquet is for uncontrollable, but the first thing we're going to do is we're going to go and we're going to try and show you how to do controllable.
Sorry.
I have to wait for my patient to stop dying. Okay? My patient is dying due to controllable blood loss. Now, blood freaks a lot of people out. Okay? Once it's out of the body, you can't really do anything with it. You can't put it back in. So you pretty much just have to stop it. Okay? Plug the hole. Now, right about here, we're going to assume that my patient has arterial bleeding or a lot of blood. Okay? Just say a lot of blood, a shit ton of blood. The first thing you always do is apply pressure. Okay? Put my hand on it. Did it stop the blood? If it stopped the blood, then, well, I'm not done. I can't walk around like this shit with my hand on, well, I could walk around with, but anyway, I can't walk around with my hands on the patient's thigh all day. So you have to bandage this area. Now, it could be as simple as taking like a piece of cloth, okay, and, just stuffing it on there and then wrapping it around and tying it tight, making sure the knot, here, let me demonstrate. Okay, taking it and wrapping it around, putting some cloth or whatever here and making sure the knot is on top of the wound and tightening it down. Okay, and if it stops the blood, kick ass, everything's all good. Now, the first thing I want to mention is sterility. Okay, sterility is overrated. You can treat infections later on at the hospital. If I need to stop this bleeding, I'm going to stuff whatever I need to in there. I don't care if it's your dirty sock, I don't care if it's your underwear. If it works to stop the bleeding, it's good to go. Okay, this is just a triangular bandage. Basically, it's just a bandana. Okay, this can stop a shit ton of bleeding. Now, if it's a bigger hole, okay, you can always crumble it up and stuff it in there, because now you're giving the blood more surface area to clot around. Okay, now say simple pressure doesn't work, and it's still gushing out from underneath my fingers, which means I'm going to have to apply something pretty serious here. Now, once I pull my hand off, it's going to bleed a lot. So, like I mentioned in the other video, use your knee. Okay, there's a bleeding right here. Kneel on it. Put your weight on it. Yeah, it's going to fucking hurt, but you're going to live. And tell them that. Shut up, you're going to live. Put your knee on it. Okay, now I have both hands free. Now, what we're going to do is we're going to demonstrate some commercially available bandages. Because like I said, you can just use cloth. It works fine. But everybody loves these high-speed shit, like this is North American Rescue Products Emergency Trauma Dressing. Ooh, it's all vacuum-packed, okay? What's funny is this basic thing has been around for like 30 years. But now that it's vacuum-packed in foil, it's all good to go. What this one is you have an absorbent pad and some Velcro. And then you have a cubic shit ton of wide-ass ace wrap. And then over here, there's the little clippy things, okay? So if I was kneeling on it, I'd go and pick up my knee, put this on it, and kneel on it again, okay? Now, unwrapping this was a dumb idea. I was just doing it to show you, because if it's all bundled up, it's easier to negotiate. And you would go and wrap this around the leg, okay? And you would crank the bitch tight, okay? Right across the spot where it's bleeding, okay? Pass it around. Crank the fucking thing down, okay? I mean, like, put some fucking nut into it. Okay, don't be like, ooh, I'm just going to wrap it softly. You are stopping bleeding. Now, people are all like, whoa, what if it acts like a tourniquet? Okay, with your hands on an arterial bleed or a heavy bleed like here, you're not going to occlude it, okay? Not by hand, not without a windlass. Now, on an arm, maybe. But what you can do afterwards is check a distal pulse, okay? If you don't know what the fuck a distal pulse is, learn. Or check capillary refill. Basically, if you press in the nail beds of the fingers or the toes, they'll bleach out, and then when you take the pressure off, they go back to pink. Make sure that they got a pulse, capillary refill. If they don't, you might need to loosen this up. But then again, yeah. What's more important? Stopping them from bleeding out? Yeah. So, I'm going to basically just crank this bitch down. Okay? And then when you get it all the way to the end, that's when the little clippy thing comes in play and you slide it under and it clips in place. Okay? Or if you got a knife, what you can do is you can also split this so it's 2 pieces of cloth and then tie it around and tighten a knot. Okay, now, the biggest question I was getting is hemostatic agents, okay? Like this. This is quick clot combat gauze, okay? For temporary external use to control traumatic bleeding. Not paper cut. Not scrapes and boo-boos, okay? If there's a, oh my fucking god, shit ton of blood, then you can consider using this, okay? Road rash is not used for quick clot or anything like that. Now, I'm not going to get into all the powdery shit, okay, because actually the powdery shit takes more skill. Remember, you got a lot of blood that's gushing out of here. When you go and you dump powder into it, the blood is going to push the powder out. So you actually have to learn a little bit of technique in order to stop the blood. Now, with stuff like this, or Hemicon dressing, or there's a bunch of other different products, but we'll stick with the combat gauze because it's pretty much an industry standard. What it is, looks like gauze. Well, looks like toilet paper. But what it is it is treated with an agent that promotes clotting and stopping bleeding. Now, depending on the size of the hole, would dictate what I would do with this. If it is big enough for me to stuff this entire thing in the hole, I'm going to stuff it in the hole. If it's a bullet wound, okay, which that's the common thing, everybody wants to know, how do I treat a bullet wound, okay? If it's gushing a lot, if it's blood is coming out and you can't stop it with normal pressure, okay, you take the quick clot, the gauze, and you start stuffing it in the fucking hole, okay? And I mean, like, stuffing it. Like, get your finger in there, okay? Pack that shit in there, okay? Yeah, your patient's gonna be, ah! Okay, who cares? They're living. Push the fucking shit in, I mean, like, in the hole, okay? And pack it in there as tight as you can. Because that's how this works, okay? It needs to be in there. Okay, now that's the problem with, like, the powdery shit, is if you have a small hole, you're not going to be able to really get into there. And yes, a bullet wound could cause that sort of problems, you know, where you have a small little ass hole, but a lot of bleeding coming out because it tagged something internally. But with this stuff, like I said, you pack it in. This is, even though it is rolled, is not to be wrapped around the wound. It is to be stuffed in the wound. Now, I'm stuffing it in there, 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 okay? And I'm packing it as tight as I friggin' can, okay? And then I got this shit left. Guess what I'm going to do with this? I'm going to put it here, okay? Now, securing this, you can secure it by whatever method you want, okay? Here's a trusty cravat, or a bandana, or whatever. And then I can go and tie this around there, okay? And like I said, bring the knot over and tie it on top of that. And ignore it. Take a look at it. Is it bleeding? If it's stopped bleeding, I'm good to go. If it is still bleeding, even after this, or even after a larger bandage, okay, don't remove shit. Okay, don't pull this out, okay, and add more. Okay, it doesn't work that way. If this is not doing it stuffed in there, then stuff more in there, okay? If this bandage is soaked through and is not doing its job, put another fucking bandage on it, okay? If this cravat is all you got, okay, and it is soaked in blood and it is not clotting, okay, I will take it, wring it the fuck out, and then stuff it back in there again. And then I'll go and I'll grab your fluffy purple sock and stuff it in there too. Because I can treat infection at the hospital. I can't treat death at the hospital. Okay? Now, once again, this is for controllable massive hemorrhaging. There's a lot of nasty wounds that you're going to see that are be like a big-ass gouge, okay? But it's just oozing blood, okay? Just capillary blood or, venous blood where it's darker in color and it's just flowing out. That's not really a panic situation, okay? I mean, yeah, it's bad, but it's not as bad as bright red blood gushing out everywhere. But these steps are simple steps, okay? Pressure, okay? Add stuff and pressure, okay? Add more shit and pressure, okay? You see a repeating theme here? And if that doesn't work, okay, you whip out the fucking tourniquet and you put a fucking tourniquet on. That's it. Okay? If you guys have any more questions or any more requests, please send me an email or stop by pirate4x4 at jkowners.com, and you guys have a good day.